Uh, Today we discuss MCQ for ENT part 2, and we start MCQ. Test for auditory system topic name, and start MCQ. Which is the cold water not used in CNC? Uh, A. Cold water lead to the wax infection. Cold water lead to the foreign body infection. Can cause the tympanic membrane rupture. Can cause vertigo. Why is cold water not using in syringing? Can cause the vertigo. In auditory or notch is seen at 4000 Hz. This is most likely due to noise inducing hearing loss. Maximum tolerable noise according to Government of India guideline is the 90 decibel in 8 hours per day for 5 days per week. The graph autosclerosis in tympanic membrane is AS. Which test is used for the B is the otitis media with effusion. A is the normal. Which test is used for the screening for the neonatal deafness? ABR. Autoacoustic emission comes from ventricle, cochlea, sacral and semicircular canal. Which one is the correct? Autoacoustic emission comes from the cochlea. Tone decay is seen in acoustic neuroma. Galley test is done for which one is the correct? Otosclerosis, senile deafness, traumatic deafness, congenital deafness. Congenital deafness is the done for the Galley test. Negative Rani test is indicate which one is the correct? Manette disease, CSOM, BPP, sensory neural hearing loss, CSOM. Pure tone audiometry symbol X is used for left ear conduction. Most common frequency of tuning fork is used in ENT is 512 Hz, 512 Hz. Which of the following is the best tuning fork to the Rani test and Weber test? Which of the following is the most tuning fork to do Rani test and Weber test is the 512 Hz. All of the following tuning fork is test. All of the following are the tuning fork test except in the Galley test, Rani test, Sachin test and pure tone audiometry test. Pure tone audiometry test are not of following are the tuning fork test. Autoacoustic emission are derived from the cochlea. Sensory neural deafness in neonate is best diagnosed by the ABR. Caloric test is done for vestibular function. Caloric test with warm and cold water stimulate. Which of the following is the structure? Caloric test with warm and cold water stimulate. Which of the following structure? A. Sacral, B. Lateral semicircular canal, C. Superior semicircular canal, D. Posterior semicircular canal. Which one is the correct? Lateral semicircular canal is the correct. Vestibular function is tested by which one is the correct? Fistula test, acoustic reflex, galvanic stimulation, impedance audiometry. Fistula test. Vestibular function is tested by fistula test. And other topic started disease of ear treatment and rehabilitation. Mainstay treatment for blue ear is the antibiotic, nasal decongestion and antibiotic, laryngotomy and government insertion. Which one is the correct? Laryngotomy. Drug which side effect Cochleotoxicity. Cochleotoxicity is the kanamycin, gentamicin, streptomycin, minomycin. Kanamycin is the side effect of the cochleotoxicity. Most common cause of the facial nerve palsy. Most common cause of the facial nerve palsy is the idiopathic Bell's palsy. Idiopathic Bell's palsy. Flamingo pink appearance of tympanic membrane is the seen in which one is the correct? Glomus tumor, otosclerosis, acoustic neuroma, cholestoma, otosclerosis. Flamingo pink appearance of tympanic membrane is seen in the otosclerosis. Ear pain, tetanus and vertigo along with the feeling of blocked ear is feature of Coston syndrome. Is the triad. Coston syndrome triad is the ear pain, tinnitus and vertigo along with the fearing blocked ear. A patient present with the symptoms of the facial nerve palsy and bulla on tympanic membrane and meatus. Possible diagnosis is the Ramsey-Hunt syndrome. Symptoms is the facial nerve palsy and bulla. If in question facial nerve palsy and bulla on tympanic membrane and meatus is the diagnosis for Ramsey-Hunt syndrome. Granulomatous lesion in tympanic membrane and middle ear lateral is seen in chronic laryngitis. Ventilation tube in ear in case of the ventilation tube in put in the ear in case of the serous otitis media. Impaction of wax is treated with softening and followed by the sensing. In tympanic membrane perforation, graft taken from the temporalis muscle fascia. Which type of the graft? Graft auto, because on body taken from the temporalis muscle fascia, so autograft. Normal hearing sound is the 20 to 20,000 Hz. According to WHO, moderate hearing loss is defined as the moderate hearing loss is defined as the 41 to 60 decibel. Noise induced hearing loss is seen maximum 1 to not. Noise induced hearing loss is seen maximum at the 5 to 6 Hz. Meningitis bullosa is commonly caused by the virus. Bullous meningitis is caused by the virus. Acute otitis media is most commonly caused by the Streptococcus pneumonia. Which of the following is the reabsorbed otitis media development? Which of the following is reabsorbed in otitis media development? Pus, blood, air, all of the above. Air. According to TOS classification of chronic otitis media, in which of stage is the retraction pocket adherent to the handle of malleus and full extent of retraction pocket can be clearly seen in? According to TOS classification, chronic otitis media in which stage is the retraction pocket adherent to the handle of malleus and full extent to the retraction of pocket clearly seen in the stage 2. All of the extracranial complications of chronic otitis media except lateral sinus thrombophlebitis all are the extracranial complication, but lateral sinus thrombophlebitis is the not a extracranial complication. Most common intracranial manifestation of late chronic otitis media is the brain abscess. Most common extracranial complication of CSOM is the mastocytitis. Most common type of hearing loss in TB otitis media is the most common type of the hearing loss TB otitis. TB otitis media is the infection in external ear or middle ear? No. So in external or middle ear, hearing loss is the conductive ear loss, and sensory is the inner ear hearing loss. Which of the following is the classical sign of the tubercular otitis media? Multiple perforation of pars tensa is the classical sign of the tubercular otitis media. Which of the following is the following earosicle first get to affected in the otitis media? Which of the following is the earosicle is the first to get affected in the otitis media is the long process of incus. Gandingo syndrome involve which cranial nerve? Gandingo syndrome involve 5 and 6. Which one is the 5 and 6? This. Which is the not component of the Gandingo syndrome? Ear discharge is the component of the Gandingo syndrome. Double vision, diplopia, and orbital pain, retroorbital pain is the triad for the Gandingo syndrome. So which one is the not a triad of the Gandingo syndrome? Deafness. Malignant otitis media external. Causative organism of malignant otitis external is the bacteria. Malignant otitis externa cranial nerve affect 7th cranial nerve. So 7th cranial nerve. Ramsay-Hunt syndrome is due to the horse zoster virus. Which will be the probable site of lesion causing slowly progressive facial palsy? What will be the probable site of lesion causing the slowly progressive facial palsy? The geniculate ganglion. Schwarz sign is seen in the otosclerosis. Carhart nose deep at the 2000 Hz. Which of the following is the earliest and consistent symptom of glomus tumor? Hoarseness, tinnitus, and otorrhea dysphagia. Tinnitus is the earliest and consistent symptoms of glomus tumor. Hennebert sign is seen in the Meniere's disease. Hearing defect Meniere's disease is the diplacusis. In case of the BPP, which semicircular canal is the affected? Posterior semicircular canal is the affected. Referred pain, the ear is commonly from the carcinoma of tongue. Trotus triad consists all of the following except plateal paralysis, trigeminal neuralgia, sensorineural deafness, conduction deafness. Trotus triad consists of all of the following except plateal paralysis is the triad. Trigeminal neuralgia is the also component for triad of total triad. Conductive deafness is the also component for tortoise triad. So which one is the not a triad for tortoise triad? Sensory neural. Which of the following is the most prominent symptoms of the acoustic neuroma? Sensory neural hear loss is the most prominent symptoms of acoustic neuroma. Which of the following is not a feature of adenoid hypertrophy? Dull expression, open mouth, pinch of nose, crowded of lower tooth. Which of the following is not a feature? No. The open mouth is a feature, dull expression is the feature, and punch of nose is the feature of adenoid hypertrophy, though crowding of lower tooth is not a feature of adenoid hypertrophy. Adenectomy is contraindicated in glue ear, mouth bleeding, recurrent rhinosinusitis, cleft plate. Cleft plate is the contraindicated in contraindicated for the adenectomy. All of the following are the indication of adenectomy except all of the following are the indication obstructive sleep apnea is the indication for the adenectomy. Allergic rhinitis is the not a contraindicated not an indication of adenectomy. Recurrent glue ear is the indication of adenectomy and prior to the orthodontic treatment. So which one is the not an indication of adenectomy? Allergic rhinitis. Adenectomy with government insurance is treatment of choice for serous otitis media in children. A 5 years child present a clinical with complaint of recurrent respiratory tract infection. Mother complain about the recurrent infection, mouth breathing and decreased hearing. Treatment of choice of this condition is the respiratory tract infection. Mother complain about a recurrent infection, mouth breathing and decreased hearing. Treatment of choice is the adenectomy. Graft used in the tympanoplasty is the temporalis fascia. Electrode of cochlear implant is passed by round window. Tomorrow part 3 ENT MCQ, nose and paranasal sinus. Thank you.